Good afternoon and a very warm welcome from us all at McGregor Healthcare. Thank you for taking the time out of your busy schedule to join us today. We're delighted to have some key speakers who are going to give us an overview of bowel dysfunction and the positive impact that rectal irrigation can have. We'll end with some exciting news. We want to bring to you a new era in low volume irrigation. Over to you, Bridget.
I am so pleased to see how rectal irrigation has developed over the years, especially with the introduction of low volume irrigation. But before we delve into the details of low volume irrigation, I'd like us to take a brief look at bowel dysfunction. We're all aware that bowel dysfunction comes in many guises: fecal incontinence, constipation, symptoms of low anterior section, or neurogenic bowel dysfunction. I would like to introduce to you Jan Yanaku from Durham, who has looked at and will present some statistics around bowel dysfunction. Over to you, Jan.
Constipation is really common. Almost everyone will experience constipation at some point in their lives, and estimates of the prevalence of chronic constipation will of course depend on the definitions used, but it's thought that around 14% of the population globally are affected, and UK estimates are pretty similar. It's been calculated that around 200 patients a day are admitted to UK hospitals because of constipation. It's a condition that is common in all age groups, but particularly the very young and the very old, and it's twice as common in women as in men. The prevalence of fecal incontinence is often underestimated because patients or sufferers are often unwilling to complain for fear of embarrassment. The prevalence also depends on the severity and definitions used, and estimates vary between 1% and 15% in community settings. In nursing homes, the prevalence is as high as 70%. Low anterior resection syndrome describes a collection of bowel symptoms following total or partial resection of the rectum, usually as a treatment for cancer. Around 40% of patients having this surgery will suffer from this condition. Bowel disturbance is extremely common in patients with neurological conditions. Neurogenic bowel dysfunction occurs in around 95% of patients with spinal cord injury, around 2/3 of those with MS, and about 1/4 of those with Parkinson's disease. So only about 20% of sufferers with constipation or fecal incontinence will consult a physician, and referrals to secondary care are often delayed or restricted. In our Durham practice, a tertiary care service, we audited over 500 consecutive patients referred with constipation. And we found that on average, patients had had their symptoms for over 10 years before coming to us. So why is that? What's the reason for this low rate of healthcare seeking and delayed onward referrals? Well, there are probably a number of factors at play. Firstly, there is the patient reticence due to stigma or embarrassment. Secondly, there is a perception among healthcare professionals that these illnesses are mild and not serious. This is, of course, the case for perhaps 80% of patients with constipation seen by their GP. But this perception can lead to an underestimate of the severity in the smaller group of patients with more troublesome symptoms. Thirdly, there is a belief perhaps that there are very few treatments available and that these are related to lifestyle changes and over-the-counter therapies. We need to recognize that treatments are improving all the time and that there are more therapeutic options for those patients with more severe and refractory symptoms, so that earlier referral of these patients can improve outcomes and quality of life.
Thank you so much, Jan. Some very interesting statistics. It seems like the numbers are increasing year on year, and because of that, I've always believed it's important to have as many treatment options as possible, because no one treatment fits everyone. One person that was involved in the first randomised controlled trial for rectal irrigation is Peter Christensen. He has a wealth of knowledge around irrigation and today is going to share a history overview with us. Over to you, Peter.
My name is Peter Christensen. I'm a colorectal surgeon at Aarhus University Hospital, Denmark. Transanal irrigation has been around since the old Egyptians wrote about their medical practices. All the way through medical history, you can find traces of the use of this treatment modality. In modern age, treatment with transanal irrigation was first reintroduced to children with spina bifida and neurogenic bowel dysfunction. A major breakthrough came in 2006, where a randomized controlled trial showed superiority of transanal irrigation to best supportive bowel care in spinal cord injury patients. Since then, the therapy has spread into other indications. It is now very much used in fecal incontinence and constipated patients, especially in obstructed defecation. And it is also a very efficient treatment modality in low anterior section syndrome following rectal cancer treatments. The introduction of low volume irrigation will change the picture. The therapy now becomes much easier for patients to handle. It minimizes the side effects and safety issues. I'm sure that the therapy will benefit a lot of patients and has a great potential in front of it. Low volume irrigation treatment has the potential to change the picture with transanal irrigation. The minimal needed volume might be enough to ensure a sufficient emptying in patients with low anterior section syndrome. It might replace suppositories in neurogenic bowel dysfunction patients, and in fecal incontinence and constipation with minimal symptom burden, it might be enough to help them in daily life, ensuring them from the burden of functional bowel problems.
Thank you so much, Peter. Having heard what Peter has said, I would like us to now go on and visit low volume irrigation. Anton Emmanuel has been a great advocate for irrigation and treating his patients. He's going to talk to us a little bit more in detail of exactly what low volume irrigation is. Over to you, Anton.
Hi there, my name's Anton Emmanuel. I'm a neurogastroenterologist working at Queen Square and University College Hospital in London and the Royal National Orthopaedic Hospital in Stanmore. It's my pleasure to talk a little bit about transanal irrigation in this session. The particular areas I've been asked to cover have been firstly around low volume irrigation in particular and what this means. And to understand this, we have to think about the nature of irrigation and the fact that actually what we're trying to do when we undertake an irrigation is to use water as a way of distending the gut, and by distending the gut causing a reflex contraction to void it. It isn't simply the act of water washing down a dirty surface. As such, low volume irrigation can be as successful as high volume irrigation, and the cardinal thing is to choose the right patient for the right approach. At its simplest level, low volume irrigation tends to mean using a volume around about 100 ml or less. Can be a little bit more, but essentially it's something which can be filled fairly easily by the patient and therefore administered fairly easily. There are a range of systems using either catheters or cone-based systems to insert the water into the bowel, but the cardinal essence is that there isn't a need for multiple pumps of any kind of device to instill the water, and therefore it's a simpler system to use. The actual effect of the irrigation, however, should be the same whether it's low or high volume, the cardinal thing being to choose the right volume and the right way of inserting and the right devices for the patient in front of you. So who is the right kind of patient to approach with regard to using a low volume irrigation system? A lot of this, I think, relates to, number one, the patient's primary symptoms, but number two, also the setup they have that partly encompasses their own sort of other medical history, but also the practical environment in which they find themselves using the irrigation. So in terms of symptoms, we're talking primarily about a patient who has problems with soiling where they can't clear out adequately the lower part of their bowel. In other words, through natural peristalsis, their rectum is filling, but they can't adequately void what they need to, and therefore they either have a symptom of incomplete emptying and needing to strain and struggle and take a long time, or they soil either usually post voiding or at other times. So that's the kind of primary symptom, but beyond that there are the other aspects of their makeup. So patients who have a history where there may be a large amount of anxiety, that may put people off using the larger catheter-based systems, where they worry about having to insert something like that. Patients where there's a lot of anxiety around. Sometimes patients with cognitive dysfunction find that an easier system to use, a low volume system. Sometimes carers, if it's care administered treatment, prefer to use a low volume system rather than the larger volume, which is more cumbersome for patients who need that. So there's those aspects which are also kind of unbelievably important to consider, and all of this really points to the fact that in taking an assessment of the patient, you need to sort of think about this. One needs to think about this in the broadest sense about all their needs and how they can be best served through irrigation, and also being flexible. It may be that you start off with one system and then the learned experience means that we need to adapt it. So beyond that, there are the aspects of access to the toilet, where their water supply is in terms of relative to where their toilet is. Their dexterity is unbelievably important. Patients can't readily squeeze the bulb, which is what it usually is to deliver the low volume systems, and that can be an issue. But alternatively, if they have a good dexterity, then it's a lot easier to transport a low volume system if that's what will work for them. The flexibility of their wrist relative to their body, having to gain access to their rectum. So these are all kind of key factors in all that, but I think the primary thing for me, if I come down to summarizing all that, is it's around the patient's primary symptoms, most often of soiling or difficulty with voiding the lower part of the bowel when it's full, and then secondly, the aspects of practicality and convenience around what they would like to do to make their fitting irrigation into their lifestyle so that it's easy to transport, easy to use, quick to fill, quick to use, quick to dispose of, and get on with the rest of their life.
Thank you very much, Anton. When low volume irrigation was first introduced, I was over the moon, although unsure initially as to what bowel conditions may benefit. Kelly Stackhouse has been paramount in developing pathways for bowel dysfunction inclusive of rectal irrigation. So I thought it only fitting that Kelly talk us through the bowel conditions that fit within low volume irrigation. Over to you, Kelly.
Hi, my name is Kelly Stackhouse. I'm the lead nurse for the Finch service at Sandwell and West Birmingham NHS Trust. So my service is a bowel dysfunction service. So for people who've got fecal incontinence, constipation, want to poo, can't poo, for whatever reason it is that they've got these issues, we have a vast range of different treatment options available to these patients, and one of which is called the low volume irrigation, or as we call it, the washout. So basically, I'm going to talk to you a little bit on how and what the washout is. Then we're going to talk about who do we use it for, and then we'll talk about at what point of our service or treatment option or algorithm do we tend to recommend or introduce this to the patient. Who do we tend to use this product for? So we tend to use it a lot for people who've got that incomplete evacuation. They feel that it's there, they just can't get the remaining out. So rather than them sitting there straining, trying to force or having to use a finger for digitation purposes, then what we do is we recommend that they use the washout after they've been to the toilet. So pass your motion as best you can. Once you think that you've finished or that's as much as you can do, then to use the washout and empty anything else that's left remaining. We also use it for people who've got post-defecatory leakage. So whether they feel that they're incomplete or not, if they've got leakage after they've been to the toilet, so later on in the day they notice they've got some seepage or leakage in their underwear or on wiping when they're passing urine, then we would recommend that after each bowel movement that they use the washout just to ensure that there's nothing else in that rectum that can potentially then leak out later on in the day. Also use the washout for people who've got obstructed defecation, so patients who've got a rectocele, the bulge between the vagina and the bottom. This ensures that there's nothing left in there that can potentially leak out after. And we also use it for patients who've got a rectal stump or have got a pouch surgery. If they're getting a mucus buildup or a mucus plug that they find difficult to remove or pass, then we'll instigate and tell them to use a washout in order to get themselves and to relieve that pressure and build-up that can happen. People who have evacuatory difficulties, so the instigation of a bowel movement, so instead of them sitting, straining, pushing, then we would say to use the washout to initiate, and they can always use the washout again on completion to ensure that they're empty. To advocate a washout as well, if that patient's quite anxious or isn't really buying into a higher volume irrigation, we can use it for the interim phase. So in order to get that patient used to inserting something into the bottom and using smaller volumes of water to insert, then we will advise them to do that for a daily basis until they feel ready and comfortable and confident in order to move on to a higher volume irrigation. The other thing that we would also recommend is that you can use it as a combination treatment. So for some people, they'll use a full irrigation, a larger volume of water irrigation first thing in the morning, but then come the evening, may have a little bit of seepage or a bit of leakage or a bit of a feeling that they need to go. So we'll recommend that they use the washout of an evening as well to prevent any overnight leakage that can potentially happen. Washouts or low volume irrigation is also quite useful for our LARS patients, our low anterior section patients, as because we're not using as large a volume, we're not using as much pressure around that anastomosis in order for that to break down. But obviously it's advisable that you consult the consultant that the patient is under prior to instigating, and always leave it a duration of time before initiating any form of washout or insertion of anything from the bottom with our LARS patients. So where do we use it, or where do we see it fits in our treatment pathways? So we always start off, and I know most services do, with a conservative management. So we're looking at their pelvic floor exercises, we're looking at how they sit on the toilet, we're looking at how they pass their motion. So we will teach them and educate them in order to sit on the toilet correctly, using their tummy muscles to push rather than straining. We will get them sitting in that right position in order to allow the angles of the bottom to open freely in order to give them a better clearance. Should all of that fail, once we've looked at the diet and their exercise and their lifestyle, as well as medication manipulation, then I see it sits quite early stages, to be fair, within the pathways, unlike the higher volume irrigation. But again, everybody's different, and it's very much dependent on your consultation with your patient, the rapport and the engagement. But with anything that we're inserting from the bottom, it's very important that that patient is believing in that product, and that patient knows that it's going to help them and improve their quality of life. We have great successes within our service with low volume irrigation as well as high volume irrigation. We have it's the difference between that leakage, that embarrassment, that odour, that smell. It's the difference between that patient leaving the house or not leaving the house. It's the difference between that patient having a social circle, a relationship. It's so important that that patient can take control of their bowels. And if something as a low volume irrigation is where it, is introduced into their routine, and that's the difference that can actually change somebody's life. The feedback and the empowerment of patients after they've used the device, it's unbelievable. All the information about low volume irrigation, where to use it, how often to use it, the frequency to use it, is all referred back to into the decision guide. So if you're struggling, if you've got any questions, if you're unsure, you can always refer to the decision guide as a resource tool, or you can all obviously contact us as well, and we're more than happy to help and guide you in your practice if it is that you've got the uncertainty of should I, shouldn't I, can I, can't I, then ask us. We've been doing it a long time, and if we don't know, I'm sure we know somebody that does know. Thank you.
Thank you very much, Kelly. So useful to know those bowel conditions that fit within low volume irrigation. Let's increase our knowledge and understanding even further. Michelle Henderson, like Kelly, has run irrigation clinics for many years. Michelle is going to illustrate to us 2 case studies that have been successful in using low volume irrigation. Over to you, Michelle.
Hi, my name's Michelle. I'm a clinical nurse specialist in the bowel dysfunction service in Durham. I'm going to talk to you for the next few minutes about how low volume irrigation fits into the treatment pathway for patients with bowel dysfunction. We know that transanal irrigation is a highly effective treatment for our patient group. 60 to 70% of patients benefit, and it's great that we've got a range of equipment and types of irrigation to offer. So for low volume irrigation, I find that this is particularly effective for patients with symptoms like passive fecal incontinence or post-defecation seepage, and also those with perhaps rectoceles and incomplete emptying. It's also good if patients are really anxious about starting irrigation, because the equipment tends to be even simpler to use and it's just small amounts of water, so patients can build up the confidence before progressing on to higher volumes if that's what they need. So to just give you a couple of examples then, a couple of case studies. My first patient is a 77-year-old lady. She presented to clinic with an 8-year history of passive fecal incontinence. She described this as a constant brown drip, and naturally this was having quite a significant impact on her quality of life. She was a very socially active lady, but felt that she couldn't go and stay at friends' houses because she feared soiling, and she was having to wear 3 to 4 pads a day because of the amount of leakage that she was experiencing. She had had sacral nerve stimulation, but unfortunately that didn't work for her, so she was referred into the clinic. She was a highly motivated lady. She actually fully engaged with a pelvic floor exercise program. She also had biofeedback both in clinic, and she took a machine home as well. Naturally we did things like lifestyle advice and sitting on the toilet using the brace bulge technique, those sorts of things, and they helped a bit, but she was still leaking 2 to 3 times a day, so it was getting better, but she wasn't where she wanted to be. So the next step then was to introduce low volume irrigation. Originally she'd been a little bit reluctant to use that. She didn't really fancy it, but once I showed her the kit, she was quite happy to give it a go. She found it really easy to use actually. It wasn't difficult for her at all, and it really made a difference to her symptoms. She found that by using that maybe 2 to 3 times a week, just 1 squeeze of the water bulb, then actually her incontinence pretty much stopped. When it did occur, it was tiny amounts and it was much more easily manageable. So she was over the moon with that improvement, and I was able to discharge her from clinic. The second case study is a 44-year-old lady who presented with a small rectocele and grade 3 intussusception, and she was experiencing difficulties with incomplete evacuation. She was back and forth to the toilet several times throughout the day. She had tried suppositories but found that they were very unpredictable and she could only use them on her days off. She worked as a cleaner, so her job involved heavy lifting, which obviously had an impact on her symptoms. When she used suppositories, she'd have to have a good 2-hour window before they'd finished working, so she didn't find them very convenient at all. So she tried some low volume irrigation. Again, she found it really easy to use, and she was using it every day. She used 2 squeezes of the water pump. She filled it up twice, used 2 insufflations, and actually that sorted her out, and she was able to go about her daily life and was far more comfortable. So they're just a couple of examples of when we've used low volume irrigation successfully, and I think you'll agree we've got lots of patients who can benefit from this treatment. Thank you for listening.
Thank you very much, Michelle. So we've had an overview of bowel dysfunction. We've looked at low volume irrigation in a little more depth. We've looked at the bowel conditions appropriate for low volume irrigation and how it has worked. I would like to now introduce you to Lucy Allen, who is going to take a look at the impact on her clinical practice.
Hi, I'm Lucy Allen and I'm a pelvic health physiotherapist. I've been using the Qufora low volume irrigation systems for many years now, both in the NHS and in my private clinics. And I have to say it's been a game changer, both for my own practice but also for the outcomes of my patients. Now, for a lot of patients that we see in clinic, they don't necessarily need high volume systems, but I've also found that for a lot of my patients, they find those systems a bit intimidating, especially when it's early on in their treatment pathway. It can be more appropriate to use a smaller system. So I think as a physiotherapist, for me personally, I see a lot of patients with rectocele prolapses. And so for them, they might have been told in the past that, use vaginal digitation, that will help you completely empty. But not all women are happy doing that. So, when you've looked at maximising bowel emptying techniques, you've looked at diet, you've improved stool consistency, and you've worked on pelvic floor strength, but they still have that degree of incomplete emptying. And these might be patients who aren't surgical candidates or who don't want to have surgery. Being able to have a low volume irrigation system to flush out that pocket makes a massive difference. It means that you can empty the bowel, they can do one nice flush out, and then that's it. They can get up and carry on with their day without that constant back and forth and that frequency that we would typically see. Now, I would also use the low volume irrigation systems with my patients who have a degree of intussusception, and there might be an element of trapping with that, but also those patients who have tenesmus. So from a psychological point of view, with a tenesmus patient, when we're trying to change their behaviour around toileting, being able to say, we've got this small system and we're going to flush it out with a low degree of water, you'll then be fully clearing. For them to have that confidence that they've used this system and they've now been able to see that they've completely emptied, that makes a massive difference when you're trying to change someone's behaviour. They can use the system and then that's it. Let's just try and carry on with our normal day and normal lifestyle. I also use the low volume irrigation systems a lot with patients who have post-defecation soiling or passive soiling, or those who have nocturnal leakage. So again, those that they might have sort of a weak anal canal or large hemorrhoids that are getting in the way, and that really affects that kind of snap shut mechanism. So again, for them, having the choice of a low volume system, because they don't really need high volumes amount of water for those types of problems. It's not intimidating, it's easy for them to use, and they can flush, and then that's it. They know that they're clean. And I think feeling clean for those patients when they've spent so long wiping and showering after every bowel movement, to know there's a quick small system that they can use, and then that's it, is a complete life-changing thing. So I think for my patients that I see, having the option of a low volume system versus a high volume system, or for those that are going through repeated colonic irrigations, for something that actually doesn't need these sort of massive amounts of water, is huge. And all of my patients give the positive feedback that with the Qufora systems, the little things make a difference to our patients. So having, the cones that already have the lubricant on them, game changing. And being able to just simply put it together, use it, and then you're done. It's not a complex system to use, but also the fact that it's marketed in a way that you can just put everything in your bag and then you can take it with you. You can chuck it in your suitcase and off you go. It's those things, I think, for a patient experience that make a big difference. So for me, being able to have the option of a low volume irrigation system has hugely changed my practice. And as I say, for my patients, when you've tried everything, sometimes all you need is just a washout system. And having a system that has been tried and tested repeatedly, I think for me as a clinician, it's very reassuring, and my patients just really get on with them.
Thank you very much, Lucy. So good to see how it works within clinical practice. I'd like to now hand you back to Sue.
Thank you, Bridget. It's so useful to go through the history of rectal irrigation and how it's helped so many people over the years. Of course, low volume irrigation is relatively new, but it has been proved to help with so many conditions. We're really excited today to bring to you a brand new product in our Qufora range. It's specially designed for low volume irrigation. Let's take a look. Wow, we hope you like our new addition to our Qufora range, Qufora IrriSedo MiniGo. So how did we develop this fantastic product? Let me introduce you to Emily, the marketing director at Qufora in Denmark. Over to you, Emily.
Thanks for that, Sue. Isn't that exciting? I'm Emily, marketing director at Qufora, and I want to talk to you in more detail about this amazing new product, Qufora IrriSedo MiniGo. How did we take the innovation of our first generation irrigation product even further and come up with the concept for Qufora IrriSedo MiniGo? Let's hear from Milena, design manager at Qufora R&D.
At Qufora, we are inspired by the needs and challenges of users with bowel problems, and also by healthcare professionals prescribing irrigation solutions for their patients. That's why we spend a lot of time understanding both patients and users and healthcare professional experience. I would say it was in the very center of the development of MiniGo. So we took all these important observations and data back to the drawing board and created a completely new solution for low volume irrigation, with the aim of a better user experience in the center of it all. We designed MiniGo to be more discreet looking and less medical than the previous generation product. Also, with the aim of it being much easier to use and to give a more approachable start to irrigation. We also thought about the healthcare professionals and how MiniGo could be easier for them to train in their daily life to give a more simple patient training experience.
Thanks for that, Milena. We are so proud of Qufora IrriSedo MiniGo, a product that's designed for a new era in low volume irrigation. A product that's building on our strong foundation within low volume irrigation. A product that meets user needs in an even more simple way, because we understand that an easy and efficient irrigation procedure can help people with bowel problems live a more fulfilled life. Let me tell you about 3 ways in which Qufora IrriSedo MiniGo is designed to be an easy solution for your patients. 1. Qufora IrriSedo MiniGo is easy to fill. The great advantage is that it can be filled directly from the tap or from a jug, making it so easy. And just like a bottle, you can see when it's full. The flip lid has an audible click sound so that you can hear that it's securely closed. 2. Qufora IrriSedo MiniGo is easy to squeeze. The soft pump has an easy grip shape and is made of a soft material, making it easy to hold and squeeze. The installation of water into the rectum during the irrigation procedure can be controlled by squeezing again without inserting air into the rectum. Up to 160 milliliters of water can be instilled into the rectum during the irrigation procedure without needing to refill the soft pump. 3. Qufora IrriSedo MiniGo fits in with everyday life. It has a compact design and it looks discreet. In the bathroom at home, and in the handbag or backpack for transporting it for irrigating away from home. It's intuitive to use and it's easy to handle, which can also help support the goal of healthcare professionals in giving an efficient training to new patients in low volume irrigation as a quick procedure that can fit into the everyday life of your patients. We're thrilled that Qufora IrriSedo MiniGo has won the Red Dot Product Design Award for 2021. We're delighted how the judges recognised how Qufora IrriSedo MiniGo fits into everyday life, both during the irrigation procedure itself and how it fits into everyday life between irrigations. It's a compact and discreet product, and with its approachable design can fit into everyday life just like any other personal hygiene product, whether it's in the bathroom or when bringing it with you. It makes us so proud that Qufora IrriSedo MiniGo has won the Red Dot Product Design Award and thereby recognised by such a renowned jury as a product that's truly designed for a new era in low volume irrigation.
Thank you so much, Emily. That's so exciting. We're also really keen to find out what patients would think about Qufora IrriSedo MiniGo. So we want to share with you the experiences of Tony, Sally, and Emma from the moment they first see the product and then right after they've used it.
Good morning, my name's Tony Curry and I'm here today to talk to you about your Qufora products. So I've been sent this, I haven't opened the box yet, and here's the cone. So first time I've seen it. Feels completely different actually, a different type of plastic and far more pliable. So let's have a look at the cone, never seen this before. All right. That looks a massive improvement. In terms of the product, my first impressions are fantastic. It looks as though you've made some really important improvements, and I'm actually, strangely enough, looking forward to using it. So today is the day that I'll be using or trialling the new product for the first time. It's very easy, very simple to assemble, and it's almost ready to use. My first impressions of the product were excellent. Personally, I'll say it as a fantastic next generation product to the Mini that I've used for the last few years, with its real important enhancements. It's without doubt a product that will continue to make a huge difference to me, and I'm sure hundreds and thousands of your users. It helps clinically, hygienically, emotionally as well. Makes a massive difference to people like me that suffer with a bowel condition such as the one that I have. The look and feel of the cone is absolutely brilliant, I have to say, and for the user the cone is arguably the most important part of the equipment, and the lubrication on it is really effective. The look and feel of the pump as well is also completely different, and very much improved. It's made of a material that's easier to hold in the palm of your hand. It's a lot bigger, so it holds a lot more water, and for me that makes a huge difference to making sure that the lower bowel is fully evacuated. There's also the addition of a hinge lid and clip, and again that's a brilliant enhancements to the product, particularly for anybody like me that occasionally you need to use the product in public conveniences. You're not always in the luxury and privacy and convenience of your own home. I guess in summary, a fantastic enhancement to an already brilliant product for which I'm a huge advocate.
It's easy to say Qufora changed my life, but 5 years ago it did just that. I was able to exercise again and go out feeling safe. The new MiniGo is a star. It comes in a smart pouch, but the best thing is the pump with its soft bulb and the ease with which it can be filled and pumped more than once. This is a really clever new design, and I don't see how you could improve on it. Well done.
Hello, I'm Emma. I'm 54. I've been having bowel problems for the best part of the last 20 years. It initially was chronic diarrhea, and now it's the opposite, and for the last 10 years my constipation has got progressively worse. I was introduced to irrigation about a year ago, over a year ago, year and a half, and it has completely changed my life. The constipation was ruining my life in that I never knew when I was going to go. I was getting rectal bleeding. I was becoming incredibly windy, which was very embarrassing, and it became really quite debilitating, and I was bloated the whole time. So with irrigation, all of those problems are behind me. So here's my new box. Okay, let's have a look. So this one, I've got a waterproof toilet bag, so that's quite useful. So when lockdown ends and we're allowed to go away, something nice and handy to take it with. Now, I had no idea what to expect of the pump. I had imagined it was going to be similar to the other one, but it's not at all. Wow. And that is very easy to squeeze, very much easier than the other one. I think that's brilliant. And it looks a lot less clinical than the previous product. It looks, well, it could almost be a product for a baby as opposed to something that you'd look at and think, oh, I know what that's for. Overall, first impressions, really good, really good. Well, I've just filled this with water in the bathroom. I'm thoroughly impressed. Previous irrigation method I was using, you'd have to fill the sink with water and then you'd suck the water up into the pouch. This one, you literally just fill the pouch with water, shut, and you're done. So much more hygienic and just, as I've said before, soft and squeezy, it's going to be very easy to use. I also think for the hand, the previous one was rugby ball shaped, and so sometimes it was a little bit tricky to get your hand round. The main part of the pouch is at the base, and I can see it's just going to be much easier to use because of squeezing the bottom of the pouch when in use. So overall impressions are brilliant. I'm not very imaginative. I didn't think the product could get any better than it was, but on first impressions it already is. My overall impression, brilliant. It's an enormous improvement on the last one. It looks a lot less clinical. It looks more like an everyday product that people won't necessarily ask about. So overall, huge improvement, and I'm definitely going to keep using it.
It's great to hear about all those experiences and how much they loved MiniGo. In particular, the positive impact it had on their quality of life. I'd like to say a big thank you to Tony, Sally and Emma for taking the time to give us their thoughts.
We hope you've enjoyed the webinar today. I'd like to say a big thank you to all our presenters and their contributions. We hope you are just as excited as we are about Qufora IrriSedo MiniGo.
The McGregor team look forward to seeing you and hearing your thoughts. We'd like to leave you with some highlights from today's webinar.
The introduction of low volume irrigation will change the picture.
So only about 20% of sufferers with constipation or fecal incontinence will consult a physician.
As such, low volume irrigation can be as successful as high volume irrigation, and the cardinal thing is to choose the right patient for the right approach.
It's so important that that patient can take control of their bowels, and if something as a low volume irrigation is where it, is introduced into their routine, and that's the difference that can actually change somebody's life.
So for low volume irrigation, I find that this is particularly effective for patients with symptoms like passive fecal incontinence or post-defecation seepage, and also those with perhaps rectoceles and incomplete emptying.
So for me, being able to have the option of a low volume irrigation system has hugely changed my practice.
We took all these important observations and data back to the drawing board and created a completely new solution for low volume irrigation, with the aim of a better user experience in the center of it all.
We are so proud of Qufora IrriSedo MiniGo, a product that's designed for a new era in low volume irrigation.
A fantastic enhancement to an already brilliant product, for which I'm a huge advocate.
Overall, huge improvement, and I'm definitely going to keep using it.